Hello everyone, I'll be walking you through traumatic brain injury. This topic report is created for the course EDU 5683, Effective Inclusion Practices, instructor Dr. Nancy Cobal. Southwest Baptist University is a Christ-centered, caring academic community preparing students to be servant leaders in a global society. TBI defined. A traumatic brain injury occurs when the brain is wounded due to some kind of external blow to an individual's head. TBI might be the result of a car accident, physical abuse, sports injuries, or any other event involving potential physical harm to the brain. The Department of the Defense and the Department of Veterans Affairs define TBI as any traumatically induced structural injury and/or physiological disruption of brain function as a result of an external force that's indicated by new onset or worsening of at least one of the following clinical signs immediately following an event: any period of lost or decreased level of consciousness, any loss of memory or events immediately before or after the injury, and any alteration in mental state at the time of injury, such as confusion, disorientation, or slowed thinking. A glimpse into what TBI looks like. Falls are typically the leading cause of TBI, and the highest rates are in children aged 0 to 4 and adults over the age of 75. Motor vehicle-related injuries is the second highest compounded. TBI rates are typically higher for males than in females, and approximately 75% of TBIs are concussions or in another form, such as mild TBI. So let's take a quick look inside to gain an understanding of primary injury. This is a type of injury that occurs at the time of injury when it's penetrating or the head opens in some type of direct impact, which can be severe or even fatal. Understanding secondary injury means that this results from various molecular injury mechanisms, such as neurotransmitter-mediated excitotoxicity, hypoxia, hypotension, seizure activity, intracranial hypertension, and even fever. What to look for as possible symptoms and signs of head injuries: loss of consciousness, possible bleeding or fluid drainage from appendages, slowed breathing, confusion, and even seizures or headaches due to swelling. As teachers, what should we expect? Possible changes in behavior, academic difficulty, which might depend on the injury, functional delays that might relate to speech, movement, and communicative characteristics, fine motor skill delays, such as writing with a pencil, or psychomotor skill delays, such as mopping the carpet. The personal story I'd like to share with you is in regards to my grandmother. She has psychomotor epilepsy, which was also a traumatic brain injury-related injury, and the confusion as such takes place, whereas maybe instead of sweeping the floor with a broom, she might actually mop the carpet and confuse what should be used in a different context. First, signs and symptoms. How should we react or not react? There's strength and determination during seizures, so be very careful to try to attempt to control someone who might possibly be having a seizure due to traumatic brain injury. And communication. Some concerns we might hear from parents include academic performance, school-developed transition plans, fatigue and concentration during long periods of work, making up the work that might be lost after needing breaks, and homebound tutoring, which might be the result of in an environment where the student may need to be homebound as a result. Non-surgical interventions for children with TBI found that educating parents on the symptoms and recovery had a positive impact on decreasing the parents' anxiety. Also, educational services are available in hospital settings, at home, and in a variety of school placements, according to the research as shown. As educators, we should look for the following things when working with students with traumatic brain injury. Students tend to overestimate their abilities, such as running after a ball. Lowered social inhibition and judgment. Also, lowered impulse control. Faulty reasoning, such as the student makes accusations towards other students or possibly the instructor. Lowered initiative, which means the student doesn't begin without a reminder. Depression, or maybe they're uninterested and passive as they seem, although this is related to depression and fatigue as a result of TBI. The result of injury and possibly medication. Acting out, yelling, cursing, walking out of the room, and even pushing a desk might be factors that you might see in a displayed behavior. Impulsivity, difficulty waiting in line to get a drink, or maybe even rigidity, difficulty adapting to the changes in routines. And the flat effect, which means they seem to be expressionless and without voice inflection. There might also be low motivation among students with TBI because they are confused or they have the inability to plan at times. Here are a few tips for teachers in inclusion. Provide repetition and consistency. Make sure that you probe skill acquisition frequently and provide repeated practice. Teach compensatory strategies for increasing memory. Also, keep the environment as distraction-free as possible, while providing rest breaks as needed due to fatigue. Also, reinforce lengthening periods of attention to the appropriate task, and demonstrate new tasks, state instructions, and always provide illustrative examples of ideas and concepts to help further the student's opportunity to be included successfully in the regular classroom. What do schools need to know about children with brain injury?
As I've been indicating, schools are a big issue in a child with a brain injury. And that's partly because schools are where children spend all their time, 6 hours a day. And in many cases, probably children are seen by their teacher way more than they actually see their parents, because the parents get up and go to school. Go to work, and the child goes to school, and the parents come home, and then there's dinner, and the kid goes to bed, and so the teacher actually sees them more than the parent. And then at the school, all those behavioral problems that I talked about and the frustrations can occur. The child has the problems with learning, so what can the teacher do? Hopefully, in the States, there will be what I call a school liaison person for all the schools, so that there's someone that they can contact who can help them understand what happened to the child, what the child's needs are, and what they can do to help the child to make the modifications. But
now we find out in the video how working with the parents from home and identifying those behaviors help facilitate success in the classroom.
Working with the parent very closely so that the two of you are responding to the same behaviors in the same way, developing the school environment in a way so that the child is not frustrated and managing, so you prevent the outbursts rather than having to deal with the outbursts. There's a host of other individual ideas that can be put into place, from color coding their subjects for them to giving them a school buddy which would be like an older student, who is usually a girl, because girls tend to want to do more of these things. But the older student who wants to be a teacher or a physician or some kind of helper can agree to meet that child in the morning, go over what were they supposed to have prepared, did they bring it, what's their day going to be like, sort of prepare the child for it, and then meet them at the end of the day. So what happened, what are you supposed to take home, what did you learn today, and give them a chance to review it. But it's done in a way that's again a bit more natural, that the child's meeting another kid, and they're going, when in the teenagers, they go for a coffee at, well, what would be Tim Hortons in Canada, so maybe Starbucks here. But again,
very exciting that she begins to talk about how children with brain injury also need the same interactions and enjoy the same interactions that all other students do as well. So this really points toward what school needs to know for effective inclusion practices, and setting the example, as well as the teacher modifying and adapting assignments to accommodate. Next, we will hear from Ms. Glang about recognizing a child's early brain injury, possibly even later in development.
The biggest challenge with children as they age is that often they grow into their injury. So we might have a child who's injured at 18 months in a car crash, and they come back, they are treated medically, they go back home, and they seem to be developing fine. And everyone thinks nothing of the injury, and in fact oftentimes don't even remember the injury, and don't communicate the information about the injury to professionals who are then in the position to serve the child. So the child gets to first grade, kindergarten, first grade, second grade, they do fine, because in those situations we talk about the teacher serving as the frontal lobe. So the teacher saying, Johnny, pick up your pencil. Johnny, write the letter 1. Johnny, put your pencil down now. Johnny, take your pencil and put it in your desk. So one-step commands, very simple to follow. But when you start getting into 3rd grade, 4th grade, 5th grade, and you're asked, okay, Johnny, I want you to write a book report about one of the books on the board here. Pick a story and then write a summary of that and tell us what you think about that story. Well, that's a very complex set of tasks and involves sequencing, involves lots of abstract thinking and planning and organizing. And that's just where a lot of kids with a brain injury will fall apart. So maybe Johnny starts having trouble. Nobody remembers at 18 months he had an injury. Nobody connects those dots, and that happens an awful lot. We see it also in moving from a child who's had an injury as an elementary school age child, and then as they get into adolescence, we attribute a lot of the problems they're having socially, cognitively, behaviorally to adolescence. They're lazy, they're not motivated, they come from a bad family, no one remembers the injury. And that's really kind of the story in childhood brain injury. We don't remember the injuries. And
so are we somehow forgetting sometimes to assess whether or not the injury has actually occurred? Or are we actually saying that as a result of the injury, there are behaviors, or as a result of other opportunities that the student seems to be having, or issues that this seems to be having, that we've forgotten that there might have been an injury, or has that even been assessed? I really like Ms. Glang's version of recognizing whether or not a brain injury has occurred, and so often it might have happened and we didn't even know it.
It's not on the radar screen of a lot of schools, so that some of those behaviors that might alert you or I don't alert the teacher who's got 35 kids in her class and is trying to, figure out why Johnny's misbehaving.
Very interesting from Ms. Glang. Thank you. Following up, we'd like to offer some concluding instructional guidelines. Using others as a resource, seek out the expertise of students, parents, other school personnel, and health-related professionals, and be flexible in your planning as a teacher. It's okay to make last-minute changes in response to day-to-day changes in the student's condition and their readiness to learn. Be ingenious and creative. One of our greatest rewards from working with students is helping them discover their strengths and ways to demonstrate them. Continue to make environmental changes if it's necessary. Change the location of the materials and equipment. Make the work surface modifications, such as an example of raising a desk so a wheelchair will fit under it. Object modifications might mean attaching clips to a student's desk to attach papers so they don't fall off or get mixed up. Manipulation aids might also use a page turner to reduce dependency on others and promote independence among the classroom learning environment. Finally, promoting independence upon students with special needs, and even more so, traumatic brain injury. Use large print so students may see the materials more clearly. Use any kind of assistive device such as technology to increase and improve independence, like an iPad or an iPod. Schedule students to help gather information for the student with TBI as a buddy system, as we heard in the video earlier. Assign classmates. Ask a volunteer to help with note-taking. Ask students if they would prefer an oral assignment, if the writing is particularly difficult for this student. Work closely in relationship with the special educator in all facets to maintain and to ensure positive learning environments and outcomes. As you will notice, there's a variety of references. I'd like to thank you for listening to the Traumatic Brain Injury Topic Report for Dr. Cobol's class in Effective Inclusion Practices. Please feel free to contact me with any questions further at 573-247-7878 or to email me by course mail in the course mail feature in Angel. Thank you for your time, and I hope you have a great day.